Respirator fit testing is necessary to ensure that workers wearing respirators are properly fitted before entering a hazardous environment. Federal law requires that respirators at your company be used in conjunction with a written respirator program meeting the requirements of the OSHA Standard for Respiratory Protection, 29 CFR 1910.134, available from the U.S. Department of Labor, Occupational Safety and Health Administration. Read the OSHA Standard in conjunction with this video before performing fit tests. For the next few minutes, we'll discuss OSHA requirements for fit testing and the proper methods for conducting fit tests. Though we'll be using half masks to demonstrate fit testing, the same general practices apply to full facepiece respirators. Individual facial characteristics, such as size or shape, influence the way a respirator fits. Beards, sideburns, or other facial hair can also adversely affect respirator fit. Poorly fitted respirators allow dangerous substances to be inhaled, along with air, through spaces between the wearer's face and the respirator. However, most people can be properly fitted with air-purifying respirators by the use of fit testing procedures designed to evaluate mask-to-face fit. There are two methods of fit testing: qualitative and quantitative. Qualitative fit testing assesses the effectiveness of the respirator fit by having the test subject try to detect test substances such as isoamyl acetate, also known as banana oil, Bitrex solution, or stannic chloride smoke while wearing the respirator. Quantitative fit testing assesses the effectiveness of respirator fit by comparing the concentration of particles outside the respirator to the concentration of particles inside the respirator. There are 4 qualitative fit test procedures in the OSHA Standard for Respiratory Protection. Read the standard for specific instructions on test procedures. The following is the procedure for qualitative fit testing with Bitrex solution. In addition to fit testing reusable air purifying respirators, Bitrex is also useful for fit testing disposable APRs as well. This video demonstration is not intended as a substitute for the Bitrex Qualitative Fit Test Kit instructions. You must read and understand the instructions before conducting fit testing. The Bitrex Fit Test Kit consists of a test hood, a sensitivity solution applicator kit and nebulizer number 1, a fit test solution kit and nebulizer number 2, 2 sets of replacement nebulizer inserts, MSDS data sheets for the test solution, and a sample respirator fit test sheet. The sensitivity test is performed first to determine that the test subject can taste the Bitrex solution at very low concentrations. The subject should not eat, drink, or chew gum for at least 15 minutes before the test. To prepare for the sensitivity test, hold the sensitivity test applicator tip pointed upward and pinch along the full length of the tube with your thumb and forefinger to crush the glass ampule inside. Make sure the tip remains pointed upward to prevent the solution from leaking. Remove the end cap from nebulizer 1 and empty the solution into it. Do not remove the applicator tip. The tip hole is the proper size to squirt the solution into the applicator, and it contains a porous filter to remove glass particles. Replace the protective cap on the nebulizer. After explaining the fit test procedures to the subject, have them don the test hood without a respirator. Position the hood so there's about 6 inches between the subject's face and the window. Instruct the subject to breathe through their mouth with their tongue extended. Inject the sensitivity test solution into the hood through the hole in the window. Direct the nozzle away from the nose and mouth of the test subject and squeeze the bulb 10 times, fully collapsing and expanding it on each squeeze. Ask if the subject can detect the bitter taste of the test solution. If tasted, note the number of squeezes and proceed to the fit test. The minimum test threshold is always noted as 10 squeezes. If the subject has not yet tasted the solution, repeat with 10 more squeezes of the aerosol. Repeat with 10 more if the solution is still not tasted. If the test solution is not detected after 30 squeezes, the subject is unable to taste Bitrex and will require a different method of testing. If the sensitivity test was successful, remove the hood and give the subject a few minutes to clear the Bitrex taste before proceeding to the fit test. The fit test is performed with the subject wearing a dust mist respirator or pre-filter. Have the subject don and fit check the respirator in accordance with the manufacturer's instructions. Crush the fit test solution ampule and transfer the fit test solution to nebulizer number 2. Have the subject don and position the hood, ensuring that there's room for dispersal of the aerosol and for movement of the subject's head. Remind the subject to breathe through their mouth. Inject the aerosol into the hood with the same number of complete squeezes as in the sensitivity test, that is 10, 20, or 30 times. To maintain an adequate level of the aerosol during the test, inject 1/2 the number of squeezes every 30 seconds. Tell the subject to indicate if they detect the bitter taste of Bitrex at any time during the test. After the initial aerosol is injected, instruct the subject to perform the following exercises for 60 seconds each. Normal breathing. Deep breathing. Turning the head side to side, 1 turn every second. Nodding the head up and down, 1 movement per second. Talking, either reciting the alphabet or reading aloud a prepared text such as the Rainbow Passage, which is included in the fit test kit. Normal breathing. Note that certain OSHA standards require additional exercises. Some examples are asbestos, jogging in place, benzene and formaldehyde, grimacing, bending over, or jogging in place. Consult individual OSHA standards for other required exercises. Unused test solutions can be poured into any wastewater treatment system. Rinse the nebulizers with warm water to prevent clogging, and wipe any residual test solution from the inside of the hood. For further details on Bitrex testing, consult the instruction manual and the applicable OSHA standard. Before beginning qualitative fit testing with isoamyl acetate, conduct odor threshold screening. Expose the test subject to isoamyl acetate to determine the subject's ability to smell its banana-like odor. If the subject can detect the smell of bananas, have him or her proceed to the selection process. Conduct the selection process in a room separate from the fit test chamber to prevent odor fatigue. Provide a mirror to assist the subject in positioning the respirator and evaluating the fit. Have the test subject select the most comfortable respirator from a sufficient number of respirator models and sizes so that the respirator is acceptable and fits correctly. The subject must perform all donning and adjustments to the facepiece without assistance. Give the subject time to determine the comfort of the respirator on the following points. Positioning the mask on the nose. Room for eye protection. Room to talk without breaking the seal. And positioning the mask on the face and cheeks. Subjects who are unfamiliar with using a particular respirator must don and adjust the facepiece several times to become adept at setting the proper tension on the straps. Instruct the subject to first don the respirator, then seat it by moving the head from side to side and up and down while taking a few deep breaths. Next, have the subject perform negative and positive pressure fit checks as described in OSHA 1910.134 or in accordance with manufacturer's instructions. To perform a positive pressure fit check, hold the palm of your hand lightly over the exhalation valve outlet, being careful not to distort the shape of the mask. Exhale gently to create a slight positive pressure inside the mask. If air leaks out around the edges of the mask, readjust the head straps, tightening if necessary, and recheck. To perform a negative pressure fit check, if necessary, remove the cartridges and place your palms over the inhalation valves. If using a pre-filter cover, it's not necessary to remove the cartridges. Inhale slightly and hold your breath for a few seconds. If air leaks in around the sealing surfaces, readjust the mask and head straps. If, after readjustments, the mask cannot be fit checked properly, the subject must select another respirator. After conducting fit checks, the subject is ready for fit testing. Allow the subject to wear the mask for at least 5 minutes before beginning the fit test and wear it into the testing room. The fit testing room must be physically separate from the rooms used for odor threshold screening and respirator selection. OSHA regulations require that the fit test chamber be similar to a clear 55-gallon drumliner inverted over a 2-foot diameter frame, situated so that the top of the chamber is about 6 inches above the test subject's head. Place a copy of the test exercises and the Rainbow Passage test paragraph inside the test chamber. For testing with isoamyl acetate, equip the respirator with organic vapor cartridges. Change the cartridges used during fit testing at least weekly. Have the subject enter the test chamber with a paper towel folded in half and moistened with 3/4 of 1 cc of isoamyl acetate. Hang the towel on the hook at the top of the chamber. Allow 2 minutes for the banana oil test concentration to be reached inside the test chamber before starting the test exercises. If the subject detects the banana-like odor while waiting, the mask fit is not acceptable. In this event, have the subject exit the test area immediately to prevent olfactory fatigue and return to the selection area to repeat odor sensitivity screening and selection procedures. If the subject fails odor sensitivity screening, have the subject wait 5 minutes and repeat the screening. If the banana odor has not been detected so far, have the test subject perform each of the following exercises for 1 minute each. Normal breathing. In a normal standing position, without talking, the subject breathes normally for at least 1 minute. Deep breathing. In a normal standing position, the subject breathes deeply for at least 1 minute, pausing occasionally so as not to hyperventilate. Turning the head side to side. Standing in place, the subject turns his or her head slowly from side to side. Hold the head at each extreme position for at least 5 seconds while inhaling. Perform at least 3 complete cycles. Do not bump the respirator against the shoulders. Moving head up and down. Standing in place, the subject slowly moves his or her head up and down between extreme up and down positions. Hold the head in each extreme position for at least 5 seconds while inhaling. Perform at least 3 complete cycles. Do not bump the respirator on the chest. Talking. Read the Rainbow Passage. Reading it will cause a wide range of facial movements. Alternative readings that serve the same purpose may also be used. Bending over. Substitute jogging in place if bending at the waist is not feasible. Normal breathing. Repeat the first exercise. If no banana smell is reported by the subject during the test, the mask fit is considered satisfactory. Have the subject break the facepiece seal and confirm that he or she can smell the isoamyl acetate. This assures that the subject does not become desensitized to the test concentration. The subject removes the saturated towel when exiting the test chamber and returns it to the test conductor. Place used towels in a self-sealing bag to prevent the isoamyl acetate concentration from building up in the room during subsequent tests. When testing under the irritant smoke protocol, select the respirator as described earlier, but equip the respirator with P100 filters. Wear safety glasses to administer the test. Use irritant smoke in a well-ventilated area. High concentrations may cause serious injury. Do not inhale smoke directly. Advise the subject to wear safety glasses and keep his or her eyes closed to avoid smoke irritation. Break both ends of a ventilation smoke tube containing stannic chloride. Attach a short length of tubing to one end and the squeeze bulb to the other. Before testing, allow the subject to smell a weak concentration to become familiar with the characteristic odor. Have the subject properly don the respirator and wear it for at least 10 minutes. After 10 minutes, have the subject perform positive and negative fit checks as shown earlier. If, after readjustments, the mask cannot be fit checked properly, the subject must select another respirator. If the fit checks show that the mask fits properly, continue fit testing. Direct a stream of smoke from the tube beginning at least 12 inches from the facepiece, gradually making 2 passes within 6 inches around the perimeter of the mask. Be careful not to direct the stream of smoke directly into the P100 filter. Direct the subject to perform the 7 exercises shown earlier and described in Section 1A.14 while challenging the respirator with the smoke at a distance of 6 inches. If the subject passes the test, check his or her sensitivity to the irritant smoke again. If the subject responds, the fit test is passed. Failure to evoke a response voids the fit test. Fit testing must be repeated at least once yearly. In addition, because the sealing of the respirator may be affected, qualitative fit testing must be repeated immediately when a subject has a weight change of 20 pounds or more, significant scarring in the area of the facepiece seal, significant dental changes such as multiple extractions, prosthesis, or acquiring dentures, reconstructive or cosmetic surgery, or any other condition that may interfere with facepiece sealing. Maintain a summary of all test results until the next fit test is administered. The name of the test subject, the date of the testing, the name of the test conductor, respirators selected, manufacturer, model, size, and approval number, the testing agent, and pass-fail results. Fit test forms are available as well as fit test cards for each employee identifying which type and size respirator the employee has been fit tested for and when the fit testing was performed. Quantitative fit testing. For quantitative fit testing, we recommend using a port-account machine which measures the effectiveness of a respirator's seal by comparing the quantity of dust particles in the ambient atmosphere with the quantity inside the facepiece. Refer to the port-account user manual for detailed instructions on setup and operation of the system. For performing controlled negative pressure quantitative fit testing, refer to the guidelines in OSHA 29 CFR 1910. For applications where the test subject is required to fit test with the actual mask that will be used in the work area, the port-account can be connected to any reusable or non-disposable half-mask or full facepiece respirator by an adapter kit. In applications where an adapter is not required, a probed mask dedicated exclusively to quantitative fit testing may be used. The port-account software prompts the test conductor through the test protocol while recording the fit factor in each portion of the test as well as an overall fit factor. The port-account test protocol consists of normal breathing, deep breathing, head movement side to side, head movement up and down, reading, grimacing, bending over, and normal breathing. A printout of the test results, including the overall fit factor, can be generated after completion of the test. Neither of these tests should be conducted if there is any hair growth between the skin and the facepiece sealing surface. In applications where tight-fitting facepieces are required and hair growth or apparel interfere with a satisfactory fit, they must be altered or removed to eliminate interference. If a satisfactory fit is still not obtained, the subject must be fit tested for a full facepiece APR. If the subject cannot be properly fitted with a full facepiece APR, a respirator such as a loose-fitting powered air purifying respirator or a supplied air respirator must be used. Test subjects who exhibit difficulty in breathing during either of these tests must be referred to a physician trained in respiratory diseases or pulmonary medicine to determine whether wearing a respirator while performing his or her duties is appropriate. Before conducting fit tests, make sure that you read and understand the test procedures described in the OSHA Standard 1910.134 Appendix A. Fit testing, whether qualitative or quantitative, performs the vital function of making sure that respirator users are properly protected against hazardous substances in the workplace respiratory environment.